Hi there. Good evening, everyone. Hope you're all well. Welcome to the Elastoplast taping and movement series. My name is Kertanegara. I'm the head physio at the Waratahs. And before we start today, we'll just go through a bit of housekeeping. So if you've got any questions, just if you don't mind, just leaving them to the end. And then you can chuck them on the chat down the bottom of the bar there, and then address them to Elastoplast admin if you could, and then at the end of the session we can get to your questions. Lastly, if you don't mind just putting your microphones on mute during the session, that'd be great. And finally, we finish with a disclaimer. Always read the label, follow the instructions for use. If symptoms persist, talk to your healthcare professional. So today we're in, last time I spoke, we spoke at home. And today the kids were driving me nuts, so we're now in the office. And last time we spoke about the independent marker approach to rehab, and we're just following up on that. And we're going to cover the ankle, calf, and the hamstring. So I'm just going to share my screen. Waiting. Rightio. So I hope you got that. So the independent marker approach to rehab. So the products that we're using today are the Leuco Rigid Premium Plus strapping tape, 38mm. Now that's the standard tape that we use at the Waratahs for shoulders, ankles, knees, wrists, whatever. Today we're using the Leuco Band Light hand tearable, 50mm. That's the standard one that we use for overwrap for ankles, for knees, for wrists, etc., etc. We use the 75mm for line out tape and for shoulders. And if you're not one for tape and you'd rather use a reusable product for ankle stability, we suggest the Elastoplast adjustable ankle stabilizer. So the research suggests that bracing is just as good as taping when it comes to trying to prevent lateral ankle sprain. So last time we spoke about knee markers. We presented a case study on a grade 2 PCL that turned around in 9 days. And for that rehab, we used the marker-based approach for return to play. We presented the knee rehab flowchart and the markers that we used at the Waratahs for the knee, and how that was then how we could extrapolate that for use in the weekend warrior. So just to recap what the marker-based approach is. So instead of using the old school time-based approach for rehabilitation, for example, 4 to 6 weeks for a knee injury, whereby you're 2 weeks of rehab, 2 weeks of running, and then 2 weeks of training, we're using a marker-based approach to progress through rehab. So what that does is allows for a speedier return, but it also allows for a more pragmatic, targeted approach in rehab, so that we know that a player or a patient is able to return or progress through the next stage of rehab based on passing certain markers through their rehab. So it takes away the shade of grey in a grey area, which is rehab, and turns it a little bit more black and white. Today, we're going to go through the ankle, the calf, and the hamstring. We go through what the Waratahs use, and again, how we can extrapolate that to the average punter out there. I guess before I start, when we decided to come up with reasons for why we were going to use, talk about the independent marker approach to rehab, this was during the COVID period. You know, at the moment, fingers crossed, we're coming out of it, and we can start to see our health professionals more regularly. But we decided to pick this topic to allow one to independently rehab their injuries during this time, if they chose to isolate and try not to expose themselves to an increased risk of COVID-19. So I guess that's the reasoning behind why we picked this topic. So this is the ankle rehab flowchart that we use at the Waratahs. As you can see, it's broken down into 5 sections and 5 stages. So stage 1 being we commence graduated impact rehab exercises and modified lower body weights. Stage 2, once you achieve them, the markers for them, you can commence your rehab running. Stage 3, commence your change of direction rehab running, unit primers. So in union, it's scrum and line out, and commence rehab contact. Stage 4, unrestricted team training. So return unrestricted team training. And stage 5, once you achieve the last markers, you can return to play. And again, just the medical clause at the bottom, progression through each stage should align with surgeons and physicians protocol, and they should be inappropriate to nil to minimal effusion pre and post activity. So here are the markers that we use at the Waratahs for return to weight-bearing strengthening. And we will go through these tests at the end, so bear with me. And again, if you've got any questions, let us know. So we're happy with 70% knee to wall range, which is 70% of your dorsiflexion range. We're happy as a marker for weight-bearing strengthening that you can hit 80% of your single leg calf raise. So what that means is that it's how many calf raises you can do before you fatigue. And first we perform it on the unaffected side, and we normally do it to a metronome beat, so 60 beats per minute in our case. And hypothetically, if you fail at 30 calf raises, single leg, then that's your baseline on the unaffected side, and we're trying to achieve 80% of that on the affected side. So 80% of 30 being 24. If you get 24 or above, you pass your marker. Pain-free day-to-day activities, so getting out of bed, driving a car, etc., etc., and a pain-free jump and base land. Now, extrapolating that to the weekend warrior, and we're going to use this as a guide only. We're looking at a 2 centimetre difference on your knee to wall. And again, these markers for the weekend warrior are a little bit more conservative than what we'd use clearly at a Waratah level, for obvious reasons. We're looking at 90% of your 90% of your single leg calf raise, pain-free day-to-day, pain-free jumper land, and nil to minimal swelling in your ankle. So once you pass your weight-bearing strength markers, you can commence your weight-bearing strengthening. So a great example of that in the calf is a calf raise. And that's probably our primary go-to when it comes to strengthening. So along with that, you're looking at increasing your balance, so your proprioception, so single leg standing on a pillow if you're doing it at home, or a balance, bit of balance foam if you've got some. They're kind of your main go-tos when you're rehabbing your ankle at home. These are the ankle markers for return to running. For the Waratahs, we're looking at 80% of your knee to wall range, 90% of your single leg calf raise, 90% of your isometric strength. So you can do that in many ways, but the way that we do it is we load them up with their body weight on their backs. So if they're a 100 kilo player, you get them under a Smith machine and chuck 100 kilos on the bar, and then get them to hold an isometric calf raise for time. So that means just holding your heel above the ground like you're doing a calf raise. And we're counting how long that takes to do it, and then comparing that to the affected side. So hypothetically, if you can hold a calf raise on it with 100 kilos or your body weight for 30 seconds, then we're looking at 27 seconds or more for your isometric strength before you return to run. 5 coordinated hops, and at an elite level, we're looking at force plate symmetry. So the lag it takes for one, or the lack of stiffness, or the stiffness that one has when they perform a counter movement jump. For the weekend warrior, we keep it a little bit more simple. So I think you probably need full range in your ankle, 10 coordinated hops, and it's important, I think, without any medical consultation that you have no swelling in your ankle when you return to run on your own. So at this stage, we would typically support the ankle when returning to run. So that's either with ankle tape, and I know that there's been an ankle tape in service previously, or if you want to use something that's more reusable and just as effective, an ankle brace would be just as good. So once you get through those markers, you can start to run. We'd start with straight line running initially, slowly start to build up your speed, and then increase your change of direction. And within your change of direction, you can start off with a controlled change of direction. So the patient gets to determine the cut that you're performing, and then if you've got someone to help you, then progressing that to someone else cutting, and then you're reacting to the cut. So you're tracking them. Here are the ankle markers for return to train. So hopefully sport is going to start soon at a community level, and everyone here is raring to go. And if you're carrying an ankle injury, here are the markers that we suggest that you need to hit before you return to team training. So at the Waratahs, we use 90% of your 5 RM, so your repetition maximum on a single leg calf raise. We're looking at 90% of a triple crossover hop. And again, if you've joined late, I'll demonstrate these tests at the end of the talk. We're looking at completion of your rehab run and units. So again, you're looking at full scrum, full line outs. Maintaining 70% of your needle wall range post rehab run and units. So making sure that you don't stiffen up and that your ankle doesn't blow up after you start running. And passing field tests. So the two main field tests that we use at the Waratahs as a marker are your Illinois and your T-test, and you can easily Google those tests to see what they are. But essentially, we got time markers as a pass score for each of those two tests, depending on the position that you play. For the weekend warrior, we're looking at maybe these markers that we're suggesting, again, as a guide only. Single leg leap for distance at 90%. Side hop tests, completion of your running program, including change of direction, and probably maintaining 90% of your needle wall range post-running. So again, what that means is you measure your needle wall or your dorsiflexion range pre-run, and hypothetically it's a 10. And then after you run, if it's a 9 or more, you've passed your marker. If it's stiffening up to 5, 6, 7, you probably need to see your physio or your doctor to see what's going on there, or give it a bit more time before returning to train, because obviously it's a grumbly joint. You want it to be pretty clean by the time you return to train. And depending on your sport and ability to perform mini skills. So again, in union, it's your scrum, it's your line out. If you're a kicking position, kicking. But perhaps if you're a basketballer, it's making a rebound, it's shooting hoops, those mini skills. If you're a goalkeeper, it's diving across and making sure that your ankle's okay with diving. So again, supporting the ankle at this stage is critical, either with tape or with brace, and it's a pretty standard protocol at the Waratahs that if you sprain your ankle in the season or at any stage during a regular calendar year, that you'll get your ankle strapped for that entire year. So that's the ankle. The next one that we'll go through is the calf. So this is the flow chart for the calf. Stage 0, markers achieved, we can commence rehab exercises. Stage 1, if you achieve those markers, you can commence run preparation exercises. So run preparation exercises are what we do, wall drills, pogos, which I can demonstrate at the end of this talk, some sled drags, some hops and some stair runs. And the reason why we do that is because your entry-level run for a calf is actually quite taxing on the calf. So if you're thinking that your calf is fine and that you decide to go for a jog, even at 5 meters per second, your calf is under a significant amount of stress. And performing these run preparation exercises gives you a little bit more reassurance that you're ready for a jog, believe it or not, versus an ankle or a hamstring where when you're jogging, you're probably not putting a whole heap of stress through the affected area. So that's why we do run preparation exercises at the Waratah level for the calf. You can also commence lower body weights at that stage. Stage 2, you can commence rehab running below 75% of your max speed and 60% below 60% of your acceleration effort, and that's subjective. Stage 3, we're looking at commencing rehab running at above 75% of their max speed and above 60% of their acceleration effort. And again, starting your units, your scrum and line out primers. And lastly, if you pass your, if you pass your stage 4 markers, you can return to train, and stage 5 markers return to play. So the calf markers we use for return to calf preparation exercises at the Waratahs, we're looking at 85% of range, both a long leg test and a knee to wall, and I'll demonstrate a long leg test at the end of this talk. 80% of your single leg calf raise. So again, we explain this in the ankle, but looking at calf raise to fatigue, single leg unaffected, comparing it to the affected side at 60 beats per minute. 5 coordinated hops and pain-free day-to-day activities. For the weekend warrior, as we said, we're a little bit more conservative and we use this as a guide only. We're looking at 90% of your range. We're looking at 90% of your strength or your single leg calf raise to fatigue. 10 coordinated hops and pain-free day-to-day. So once you pass those markers, you can start your run preparation exercises. So that might be stair runs, that might be some skipping, that might be some pogos, whatever you fancy. You can start those graduated impact running exercises to prepare one for running. So your calf markers for return to run for the Waratahs. And you can see that these are very aggressive compared to the hamstring. As I said, the entry-level rehab run for a calf is taxing on the calf. So you need to make sure that you're ready to go. Otherwise, you're going to get your old man's calf, is what they call them, just when you just go ping, ping, ping each time you're running. So completion of run prep, pain-free and with coordination, 90% of your range, 90% of your single leg calf raised repetition max, 90% of your single leg hop for distance, and again I can explain that later, and 70% of your 5 RM, so 5 repetition max. We do that again on a Smith machine. We load up the bar, we find out what a player's 5 RM is on a single leg calf raise, and hypothetically if it's 80 kilos, then you're looking at a minimum of 56 kilos on the affected side before they can start to run. Weekend warrior, we're happy if you, as a suggestion, complete your run prep, get to 90% of your single leg hop for distance, and as a modified version and a combination of both the single leg calf raise test and the 70% 5 RM, we're suggesting a weighted single leg calf raise test at 90%. So it's how many calf raises you can do before you get too tired and you stop on the unaffected side, but perhaps with a weight in your hand. So whether that be 5 kilos, 10 kilos, whatever you want, as long as it's consistent. If you hypothetically get to 20 on the unaffected side, then we're suggesting that you get to 90% of that, which is 18 or more on the affected side before you start to run. So you're good and you start running and you're wondering whether you can return to train. So at the TARS, we use these markers for calf injuries for return to train. 100% of your body weight, 4 lots of 30 seconds is our marker. So if you're a 90 kilo halfback, then you're looking at loading up 90 kilos on your back and making sure that you can hold that isometrically, which is where you lift up your heel a little bit off the ground for 30 seconds, repeat 4 times without failure. Again, you can see that these are quite aggressive. 90% of your 5 RM. So again, if your 5 RM on your unaffected side is 80 then you're looking at 72 kilos or more on the affected side before you return to train. 90% of your triple crossover hop, completion of rehab run units, and you're passing of your field test. And as we said before, in the ankle joint, you're looking at the Illinois and the T test, position specific. Weekend warrior, return to training. We're looking at completion of your running program, similar to the ankle, and ability to perform mini skills. And if you're good enough, and it depends on your athletic ability, perhaps a 90% of your triple crossover, similar to the Waratahs, would be worth having a go at if you think you're ready for it. And again, that's for distance. So that's the calf. And again, any questions, hit us up at the end of this talk. The hamstring. So this is the flow chart for the hamstring. Last joint. Last area, sorry. So at the Waratahs, we got 5 stages, 0 to 4 for this. And the most common soft tissue injury that we get here. So stage 0, we're looking at commencing rehab exercises. Stage 1, commence rehab running below 70% speed and lower body weights. Now, again, contrary to the calf, your entry-level rehab run or your jog is taxing on the calf. It's generally pretty easy for the hamstring, so we can start hamstring running pretty quickly. The true test for a hamstring, and really the ultimate test for a hamstring, is once you start to run fast, particularly at max speed. That's when you know you've got to go, and you've got to be able to work your hamstrings, and your hamstrings have to be strong when you start running at max velocity. Stage 2, we start to run faster. So stage 2, we start to run faster. So commence rehab running below 85% of speed. Passing stage 3 markers, then we're starting to go now. We're looking at above 85% speed. We're looking at modified training below 85% speed, including units. So we're happy to start to integrate people into safer drills within training. So where they're not too open and there's no ability to start to turn on the gas and run fast, and then we can start to integrate them into training at the stage 3 level. Stage 4 is a return to unrestricted team training, and if you pass, we're missing a marker there. We're missing a return to train. I don't know why that's come off, but there should be a stage 5 in there, and if you pass your stage 5 markers, you can return to training. Sorry, return to play. Excuse me, return to play. So your markers for return to run at the Waratahs, we're looking at a negative shoulder bridge or a chair bridge. And again, we'll go through these tests in a second. A negative chook scratch or a scratch test. Negative single leg RDL. Pain-free day-to-day, so stairs particularly. And 75% of your prone curl strength. So we measure that with a dynamometer here, which is something that we use in our hands, and we can basically assess force, and we compare unaffected versus affected. For the weekend warrior, I think the 4 markers we're looking at are negative bridge repeat 5 times. We're looking at a negative scratch, a negative single leg RDL. So these are all tests that you can perform at home, and pain-free day-to-day. And clearly, when you start to run, if you don't have if you're not familiar with your rehab running process, you just start off with a slower pace run, and then progressively build up your speed when it comes to hamstring injury. Our hamstring markers for return to speed. So this is where we start to get a little bit more aggressive with our markers. So a negative Askling's H test, and again, I'll demonstrate that in a jiffy. 90% of a repeat bridge. So similar to a calf raise test, we get one to start to bridge on a chair, and we go to fatigue on the unaffected side. And hypothetically, if they get to 10 on one side, single leg, then they need to hit 9 or more on the affected side, and that's a marker passed. Over here, we've got access to a Nord board. So that's another machine that we use to assess strength in a Nordic curl position. We use the handheld, and we're looking at 95% of prone curl strength, and we do that at 5 degrees. So we do that at very minimal knee flexion when they're face down on the bed. A negative slump So for those that aren't familiar with a slump, it's a test of, I guess, neural tension, which can contribute to increased risk of hamstring injury. 90% of your triple crossover hop and passing the field test. And as we said before, that's your T-test and your Illinois. For the weekend warrior, we're looking at a negative Askling's H, 90% of your repeat bridge, negative slump, and 90% triple crossover. So it's pretty similar, and you can perform those exercises at home. Again, the triple crossover is a pretty difficult test to do, and I'll just make sure you pick your clientele before you attempt to do that, even on the unaffected side. Return to train at the Waratahs. We're looking at passing 90% or more of their maximum speed that we've determined over the past 2 years. So if their max speed is 10, to make my maths easy, then they need to hit 9 meters per second or more, and we do that by GPS. In union, we pilfer, which is in a breakdown, we go and try to steal the ball, which is a pretty difficult position for the hamstring to be in contact. And we make sure that we can pass that marker at this level, and a subjective 100% acceleration effort. For the weekend warrior, it's much the same. You don't obviously have access to GPS. So looking at a maximal effort in sprint and making sure that you build to that you don't go from 0 to hero. Maximal effort acceleration, again, building into that, and an ability to perform mini skills. So kicking, for instance, is really important, and having enough, let's say if you're playing AFL, having enough kicks under your belt and in a graduated manner, introducing that over the time when you're in rehab is a really important thing to do, particularly for the hamstring. So that's the talk. What I might do is go through the tests. I just might stop the share. And then there we go with this. So you need a wall test. Excuse the mess here. We don't have a wall, so I'll pull out this little thing. So you need a wall test is a measure of range, dorsiflexion range. And if there's any physios or healthcare professionals, you're probably accustomed to this test. So the toe and the wall. And we're looking at measuring that with a ruler and going as far back as you can go without your heel lifting. And that's a measure of, let's say, your unaffected side, and you're comparing that to your affected side. So depending on the marker, we're looking at that as a test for dorsiflexion range for ankle and calf injuries. As I said before, your single leg calf raise test, so holding on to something at 60 beats per minute and performing calf raises, 1 calf raise a second, and going until you're fatigued. I'm not going to show you the whole length of the test because it's pretty abysmal, and comparing that to the unaffected side. So depending on the marker, we're looking at a percentage of your unaffected side versus your affected side. Pain-free jump land, you're just looking at a pretty simple jump and a landing. Coordinated hops are very underrated. So coordinated hops as a marker for ankle and calf, it's just simple hops with coordination. So whatever it is, 10 hops, 5 hops, whatever it is, making sure that they're not stiff. That's not a coordinated hop. It's got spring. It just looks normal compared to the other side. Single leg leap for distance. So put this out of the way. That's a pretty simple test. You're looking at setting a line across a floor, hands across your chest, and then we're just jumping as far as we can and trying to land it, looking at the distance between the back of the heel and where you started your jump, and then comparing that to the affected side, making sure you land. Side hop test. So at the Waratahs, we use a 30 centimetre distance, And we're looking at performing as many successful side hops as you can do in 30 seconds and comparing unaffected to affected. Some examples of run preparation exercises. So rushing through this, but your pogos, that's your double leg pogo, that's your alternate pogo. Again, you can do stair runs, you can skip. There are examples of some run prep. Your triple crossover hop. So that, I'm probably not going to fully demonstrate this, but you can do this many ways, but the way that we do it is that we are standing on a box about yay big, and on the top of that box we jump down, and then from there we basically jump twice, maximal effort, crossing over a line on the floor. So it might look like this. We're looking at the distance from where you landed, from your heel to your starting spot, which is the line. Repeat bridge. Let me grab a chair. It's not gonna roll. So for your hamstring, your bridge, your return to run marker is just a simple ability to bridge up. And then your repeat bridge test is how many of them you can do before failure. And comparing that affected side to the unaffected side. I'm getting pooped now. Another marker for hamstrings is your chicken scratch test. So pretty simple, just basically scratching your foot across the ground. And those that have provocation and soreness in your hamstrings doing that test shouldn't run. So they've got to have that clear. A negative test. Another return to run marker for the hamstring is your single leg RDL. So that's just a Romanian deadlift or an arabesque, whatever you want to call it, and making sure that test is clear before you run. Your slump, for those that don't know it, you hands across your chest, slump down and extend the leg. Chair needs to be a wee bit higher than this. And comparing that side to that side. And you kind of want the same feeling and the same range in your knee, unaffected versus affected. And finally, your Aspling's H test, which is your speed marker, is just lying on the ground. And there's many ways to do it, but the way that we do it is you basically start off with one slow straight leg raise, keeping your knee straight, one slow, and then 3 fast. Comparing that to the other side. And the question that we ask our patients is, does it feel the same? Does it feel the same as the good side? And if the answer is yes, it feels the same, that's a negative test. If the answer is no, then that's a positive test and they can't progress to speed. That's it. I think we've got some questions. I might put my headphones back in. So I've got one question here. When you mentioned force plate symmetry for ankle markers, is that force plate standing or is it in double leg landing? So that's a great question. You can do it multiple ways, but you can assess your ankle through multiple means. You can do it as a double leg counter movement jump. And we do that weekly anyway as a measure of neuromuscular fatigue for our S&Cs. But I think specifically for the ankle, you're looking at it's a jump off a box and then a repeat hop. So we're looking at, let me demonstrate it. So force plates here, and we can measure the lag time. Once force plates down, we're looking at the lag time or the stiffness in the ankle as they're landing and jumping and and trying to produce force again. Another question here. I sustained a grade 3 ATFL tear and grade 2 CFL tear playing a rugby trial match 2 months ago, made a full recovery. However, recently I retore it during a running session. Knowing all ankle exercises required to rehabilitate it, would you recommend using the independent marker approach without visiting a physio? If I know the extent of the injury, would you recommend using self-taping or support as opposed to brace during training sessions or games where a physio is unavailable? I think if you have injured yourself again, I would probably recommend that you go see the person that you saw first time to make sure that you know that the injury itself is what you think it is. It also depends on how you re-injured it. So if you did it on a very entry-level run, chances are it's probably not the same injury, and it might be something else. But once you do know what it is, would you recommend the use of self-taping as support as opposed to bracing? There is no difference between taping and bracing when it comes to reducing the risk of injury or re-injury with ankle sprains. I think that bracing is just as good as ankle taping. I did my honours project on it, and in fact, a title author on the topic. And there is no difference. There is no difference between bracing or taping when it comes to preventing injury, but both means are effective in reducing the risk of ankle sprain. What we've got here, just wondering in regards to ankle rehab, if most fields are played on a flat surface, what is the reason behind retraining balance proprioception on a non-flat surface, e.g. foam or pillow? Doesn't seem specific. That's an excellent question. So it's just increasing the challenge when you are required to use it in an environment where you do get perturbed. So when you are training on a flat surface, obviously your challenge is less. And once you start to add different surfaces, you're challenging your proprioceptive system or your balance system. And when you are in a game environment, although it might be a flat surface, you are still being challenged in different ways by thinking of different things or potentially stepping on someone's foot. So I would argue that there is significant perturbation involved with games and training, and that we need to train to that level within a rehab setting. Next question here. Despite repeated stretching throughout the day, I have an athlete with constant tight hamstrings. Any suggestions? Well, does stretching work is probably my question. Look, some people are just naturally tight. That's probably one thing that pops to my head immediately. You can probably change it with thorough flexibility and mobility programs. I would suggest perhaps looking at other means of increasing or reducing one's tightness. So that might be with triggering of the hips or some slump stretching, or it might be with hip stretching, so a lot of glute releases, et cetera, maybe rolling out of the actual hamstring complex. But that might be, other than stretching, that might be worthwhile trying in your case. Last question, would you recommend taping compression for a soft tissue injury, e.g. hamstring or calf, when returning to play? Look, horses for courses, really. It's up to you whether you want to use that or not. There is little evidence to suggest that little to no evidence that it basically changes your risk of re-injury. But if you're comfortable wearing, a thermoskin wrap around your thigh or whatever you strain, or your calf, then by all means, it's not going to do any harm. Do we do it at the Waratahs? No, we don't. So definitely taping or compression immediately after an injury would be worthwhile to try to reduce the swelling in the area, but no, probably not on return to play. I think that's it. So so just concluding here, for all your products, please go to your local pharmacy or local sport wholesaler. Alternatively, go to elastoplast.com.au for more support. Thank you everyone for listening and is logged in tonight for the Elastoplast taping and movement series. I hope it's been worthwhile, insightful and useful for you. If you need more information, please go to elastoplast.com.au for more, or visit us on Facebook, Instagram or LinkedIn. I hope you have a good night. Thanks for listening. Cheers.